Hello, everyone. Good morning. Thank you so much, Kathy. You are very kind. It hasn't been 10 years. It's been actually exactly 20 years ago. But I'll take 10. It's totally okay. Yes, absolutely. Super special occasion, actually, for me to be here with you today. Because, yeah, exactly 20 years ago, I was in your seat, presenting my final project for my Master's in Public Health program at the School of Public Health with the University of Alberta, so in Edmonton. Except I was also 8 months pregnant, and exactly a month later, a beautiful baby girl was born, who is now just finished her second year at the University of Victoria. and she's here today. So truly like a full circle moment for us. And I am just so privileged and happy and delighted to talk to you a little bit about my career and some learnings, some observations, and maybe share some advice with you as you just starting kind of your path in public health. So I, after I did my practicum with the Capital Health Authority in Edmonton, so it was one of the health authorities, I actually stayed and found my first job there with them. And then I joined our Alberta Primary Care Initiative for a little bit, private consulting company, and very shortly after started with the government of Alberta, where I spent the most of my career, 16 years. Starting at Alberta Health, leading physician compensation portfolio, then joining the Ministry of Status of Women when NDP was in power in Alberta for 5 minutes, but did really interesting projects leading the design, development, and implementation of Gender-Based Analysis Plus for the whole government of Alberta. And my last position there was the Assistant Deputy Minister with Community and Social Services Ministry, where I led the portfolio for homelessness, women's shelters, sexual assault centers, and preventive community services. And yeah, finally, about 2.5 years ago, I started in my role here with the Population and Public Health Division, which is absolutely incredible opportunity and truly felt like coming back home because health is my life. I started my career as a medical doctor in Ukraine. So now I lead the incredible team of people. We about 115 people in my division, and we're doing absolutely breadth of work from health protection to communicable disease prevention to health promotion and prevention, and to all the way to designing really cool IT solutions for all the programs that we have to deliver. So, as you know, public health is a true cornerstone of well-being for people, families, communities. Like, there's no end to public health. You know, there's no boundaries around this. Like, you can just pick your priorities, pick your interest, focus on it, and work on it. It truly goes beyond the care of patients and clinics, hospitals. It focuses on support through entire lifespan of individuals and health of entire population sometimes, seeking to prevent illness, promote health, and create environments where people can thrive. It's about making sure that all community members, regardless of their background, circumstances, have the resources and opportunities they need to lead the healthy lives. In recent years, of course, the importance of public health has become more evident than ever. The global pandemic, we quickly learned what public health does collectively as a society, but it also showed us how interconnected we are and how health issues can transcend borders, affecting every facet of society, from economic stability to mental well-being. And public health is about preparing for this kind of challenges, whether communicable diseases, chronic conditions, or environmental threats. So the work that you do as Master of Public Health graduates will help to safeguard our populations, reduce those emerging threats, and ensure that public health systems are resilient in the face of crisis. For me, I think that those of us who are drawn to population and public health are inherently hopeful, dedicated, values-driven. As public health practitioners, we know that our work is about the long game. It takes years, decades, sometimes generations to see full benefits that we seek for our community. So we have to be the ultimate optimists. And we all care about promoting and protecting health, of course, and preventing disease and injuries. Public health plays absolutely vital role in upstream interventions, as you know, such as all the vaccinations programs that we deliver, health screenings, education on healthy lifestyles. And by focusing on prevention, public health reduces that burden on healthcare systems and saves and improves quality of life of our people. I truly believe that, the focus on acute care and pouring all the resources in hospitals as much as we need them, for sure, addressing this need for the frontline health service delivery has been priority, but over the decade, it truly sucks the air out of everything. And we have to think how to reintroduce that focus on prevention. We have to make sure that people have the resources and information and everything that they need to stay healthy, so they don't need that reliance on the acute care as much as we have it now. In addition, public health has a very strong respect for our beautiful natural environments, especially here in British Columbia. It's absolutely gorgeous, just mind-blowing, especially this time of the year, our lands and waters, and we absolutely recognize the interconnectivity of humans and the spaces, from air and water quality to climate change and sometimes waste management. Public health practitioners work absolutely tirelessly to minimize the environmental risks and protect people from hazards. And the focus is not only on the health of the population today, ensuring that we all live right now in safe, clean, and sustainable environments, but we also work on the health for future generation, ensuring that we have that sustainability for everyone. Of course, as you know, there are so many different ways that we go about public health work. We can lean into core and enabling activities like healthy public policy, governance, legislation, intersectorial collaboration. Here in BC, we do have unique challenges and opportunities. In the last 10 years, our population has risen by over 1 million people. And it's actually anticipated to reach almost 8 million in the next 20 years. So someone who is not born in BC and has been able to make it my home, I know the importance of fostering those welcoming and inclusive communities where everyone can continue to make the important contribution to the province, but also live their absolutely fulfilled lives. Our province also has the older population than the rest of Canada, with now more than 1 million people over the age of 65. But there are significant variations throughout the province, of course, and for example, the north is having a high population of younger adults and increasing fertility rates, while the Vancouver Island and here in Victoria, we have the highest proportion of older adults. But regardless of where you're in a province, our public health teams serve and partner with huge diversity of people and communities, from First Nations right holders to rural, remote communities, and many other diverse populations. We honor and respect the unique lived experiences in our public health approaches, and we absolutely must be grounded by truth and reconciliation, the rights of Indigenous people, and health equity and anti-racism for all in British Columbia. Health equity is absolutely critical for us as practitioners. In spite of all the resources that we currently have and see in healthcare system, there are still very significant disparities in health outcomes. And we are in the forefront of developing policies and structures that reduce disparities and promote equal access to healthcare, clean environments, housing, education. But as public health experts, you will need to work a little bit harder on dismantling those barriers that equity-deserving communities still have in accessing the care and resources and ensuring that health equity becomes a reality for all. I have so much faith that you, the next generation of public health practitioners, truly understand the health equity as our shared commitment that benefits all of us. You have a very unique perspectives right now in life. You're much more comfortable in recognizing, the gender inequalities, race inequalities. You're much more comfortable in going to have this conversation. So we absolutely need your push for everyone to lead the way that we need to get to in achieving health equity. And of course, working at the global scale, whether combating a disease outbreak or helping communities to rebuild after natural disasters, public health can truly transcend national boundaries, foster solidarity, and help us to collaborate among nations, which is truly really needed right now in the world. So we all come to this work with our own stories, whether you're a new professional or someone who is already experienced in health discipline, whether you want to work in the frontline service delivery or in governance and policy like I do. There's a place for each and every one of you in this vision. In BC, the population and public health workforce is made up of many different disciplines like environmental health officers, epidemiologists, data analysts, health promotion specialists, medical health officers, of course, public health nurses, and many, many others. So welcome to the family. You're one of us now. Practitioners truly come from diverse educational and training backgrounds, but just like you, MPH students in the room today and online, they knitted together by a common set of values, skills, commitments, and passions. So if you decide to stay in BC and work here with us, you will be joining the population and public health teams that have been recognized as true leaders in our field across Canada and globally. Throughout the COVID-19 pandemic, toxic drug crisis, climate-related emergencies, they've been truly at the forefront of addressing population health issues. However, as you know, with all of that also come the issues such stress, burnout, turnover can be real in our workforce, just as in any other areas of healthcare system. So take care of yourself. Remember it's a long game. But public health practitioners truly demonstrated and continue to demonstrate exceptional courage, perseverance, and leadership. And you will be that new spark that continue to keep our home fires burning, and we will rely on your passion, energy, and innovation. So as I'm finishing here today, I'm almost done, I just want to leave you with these 4 things to carry with you as you move through your public health careers. No matter what, never give up on prevention. That's number 1. Just truly work and make sure that all community members, regardless of their background and circumstance, have access to the resources and opportunities they need to lead healthy lives and thrive. Second, planetary health and climate change are now a quiet crisis. So we do need you to protect the lands and waters and work on minimizing the environmental risks for our people and protecting people from hazards. Health equity is unfortunately worsening, so we need your help, especially for the First Nations rights holders, to rural, remote communities, and diversity, equity-seeking populations across the province. We truly need your energy, ideas, focus and determination to truly move the dial on reconciliation and public health and improve health equity for all. And fourth, be optimists. You know, our work is not easy, but our work is absolutely crucially important. It matters to the people that may not even know it, you know, like that's kind of the downside of being in this part of the healthcare and the medical field, that the instant gratification that you get from like when you're treating people one-on-one, you're treating the whole community or populations. So it matters today, and what you do will matter from like 100 years from now. You are our future and you are our legacy. My final advice is, regardless of what your next steps are, stay connected with your faculty at the School of Public Health and Social Policy here at the UVic. First of all, they would be absolutely delighted to hear and learn about your journeys and all your successes. But also you never know when you need them. I actually, when I became director at Alberta Health, I ended up hiring 5 of my former professors from the School of Public Health. Truly, I commissioned the research. Some of them were better than others, you know. But I truly benefited from their wisdom, expertise, and were able to kind of apply everything that they were so good at. So stay connected. So I'm really, truly grateful that, you know, all of you picked that field and decided to join us in this absolutely vital sector. I commit from my kind of level and from my perspective to continue to strengthen the population and public health so it can be effective and sustainable place for you to grow and be the leaders of tomorrow. I truly hope to come across some of your names and faces as you grow through your careers and where you work in health authorities, indigenous communities, research, non-for-profit organizations, so maybe we'll decide to join our Ministry of Health. So truly congratulations on your culminating projects. Today you're almost there. Celebrate your accomplishments, stay focused, stay determined, and just really, we need you. We absolutely need you. So thank you so much again.